X-ray findings of the COPD. This hyperinflated lungs, increased retrosternal air spaces in the X-ray. In case of emphysema, I'm not going into detail of emphysema because today the topic of discussion is COPD in general. So in the coming subsequent classes, we'll be discussing about emphysema, chronic bronchitis, and alpha-1 antitrypsin deficiency in detail. So there is something called as emphysematous bullae, which is seen in the X-ray in case of advanced emphysema. Let's discuss in detail later. This decreased vascular markings in the lung field due to the lung damage. So let's discuss about the signs of COPD. As I have discussed in the clinical presentation, the patient presented with pursed lip breathing, which is something like due to the excess force which the patient is producing to the push the air outside. There will be something called as pursed lip breathing, which I have demonstrated. There is tripod position. Due to severe breathlessness, the patient will kneel down and he will keep his one arm in front like this to take the breath because he is getting dyspneic. So cyanosis, as I have mentioned earlier, due to lack of oxygen, and clubbing, as I have discussed, you have to write about Shamroth sign. So treatment of COPD, I have discussed earlier that COPD is an irreversible change. As I have discussed earlier, COPD is an irreversible change, so we don't get to do many things. The first thing is lifestyle modification. If the patient is smoking, ask him to stop smoking immediately, and he needs to get exposed to good quality of air. He needs to avoid getting exposed to lung irritants like pollen, dust, and chemicals. So the most common medications used are bronchodilators, inhaled corticosteroids, combined inhalers like samitrol with fluticasone, antibiotics during the exacerbations. As I said that even if it is a chronic disease, there will be exacerbation sometime. So adequate interventions like antibiotic has to be taken. Oxygen therapy in case of patient with low blood levels of oxygen, as seen in the arterial blood gas analysis. We'll go into details of arterial blood gas analysis in the coming lectures. And of course, physiotherapy, that is pulmonary rehabilitation therapy. Very rarely there will be surgical interventions. Let's go pulmonary. The right heart, the functions of right and left side of the heart, right? So due to the issues of the lungs, the heart is having an overload and eventually the heart fails. So that is called as pulmonary. So pneumothorax. So there will be collapse of the lungs, sometimes due to the collapse of the lungs or sometimes due to the rupture of the bullae. There will be air in the pleural space, which is called as pneumothorax, which is an acute emergency. So weight loss and muscle wasting in some cases. So the diagnosis of COPD, the gold standard diagnosis of COPD is spirometry, and we'll go into details later about the classification of spirometry in the upcoming classes. Mostly it is diagnosed with clinical symptoms and with the history of smoking. And the most common risk factors are age. The most common risk factor is age. COPD typically occurs in adult over the age of 40 years. Family history of respiratory diseases, and with clinical symptoms also we can identify. So the additional tests which are used for COPD is chest X-ray and CT scan sometime, arterial blood gas analysis, and alpha-1 antitrypsin deficiency testing, which I will be discussing in the upcoming topics. So I hope you understood about the COPD. So let's summarize what is COPD. It's a chronic disease, it is a persistent disease, it is a progressive disease which causes airflow limitation and which causes permanent destruction of the air tubules and the alveoli, which are mainly due to irritants like smoking and alpha-1 antitrypsin deficiency in some cases. And the signs and symptoms include persistent cough and productive sputum, sometimes due to acute exacerbations, reduction in the amount of oxygen. Then the signs of X-ray signs include hyperinflation of the lungs, and the patient sometimes present with pursed lip breathing, and the patient uses accessory muscles for respiration. And the gold standard test is spirometry. I think this will be sufficient. If you have any doubts, you can always reach out to me. I'll always available to clear your doubts. And you have to do the homework, the two things, the Shamrock sign and the pack here in the next class. Thanks a lot.